Sometimes small things can save your life or save your vision. Joe wants to share with you how he lost the vision in both eyes due to glaucoma. The most sad part of his story is that his vision could have been saved if he knew how to put the glaucoma drops. When Joe learned this, he was already completely blind in the right eye and had just some residual islands of vision in the left eye. You can see this in these two images. Unfortunately, now no treatment can give him the vision back. If you want to learn more about how to prevent blindness and losing vision by knowing small things that matter as much as the big things in the eye treatment, keep watching. This video may save your vision. Hello everyone, this is Dr. Narcisa Ianopol. My voice is still not fully recovered, but I wanted very much to release the last 2 volumes of my collection Explain Me Simply for you, because we have no time to lose. I have many courses in mind that I know would help many people around the world, so even if I did not beat completely the virus, I am good to go back to work. The good part is that I did not have the coronavirus infection. The test was negative, so the 3 doses of COVID vaccine seemed to work. But there are also many other viruses that can produce infections in people, not only COVID, even during the COVID pandemic. As you may know from my other videos, I am an eye doctor, eye surgeon, and clinical researcher in ophthalmology. I was trained and practiced for 28 years in European countries like Romania, Germany, United Kingdom, and United States of America. I prepared a collection of online courses for patients' education that is dedicated to people and patients like you, willing to learn science and experience in the diagnosis and treatment of the eye conditions in order to prevent blindness. These courses are published on my website iStory with Narcisa at the link in the description below this video. My mission is to empower people by getting knowledge and learning from my experience that I got through my trainings from 4 mentors, 2 mentors from Europe and 2 from United States of America. Then I improved my experience by seeing every day thousands and thousands of patients like you with ocular problems from all subspecialties in ophthalmology like retina clinics, cataract, glaucoma clinics, neuro-ophthalmology, uveitis clinics, ocular trauma, acute clinics, etc. This is the volume 4 of this collection, and it is entitled Explain Eye Treatments. This volume has basic small things that every patient going in the eye clinics and offices for any ocular problems, starting with simple glasses and finishing with complex operations after severe ocular trauma, needs to know in order to be able to respect the recommendations of your eye doctors and surgeons. Due to very busy clinics every day, this small but extremely important information may be sometimes missed from the discussion with patients or sometimes ignored completely if the eye specialist assumes that the patient already knows them. But putting together all of this information in an online course is a way to fulfill my mission to help people from all over the world and to prevent blindness even if I do not treat myself these patients. I always pay a lot of attention to my patients' education, but in our daily busy clinics, the time is very limited, and even if we want this, we do not have time to explain in very much details small things that matter for the patient to understand the treatment that we do for them, and then to follow our instructions. Knowledge means power. In the eye clinic, knowledge means vision. Joe, like many other patients with glaucoma, is now completely blind in one eye and almost blind in the other eye because he did not know a simple but extremely important thing: how to administer the drops for glaucoma. If he knew this, at this time he would have had the vision saved because the treatment with drops was very efficient in his eyes. When he understood that he put the drops wrong, he was already blind, and no treatment in the whole world cannot recover his vision lost at this time. If you want to see the story of Joe and other patients with glaucoma, and to learn many other small things that matter for saving your vision, stay tuned and take this course. The link on the slide takes you to the website where all the volumes from the collection are published. If you purchase the whole collection, you have one volume free and will pay the reduced price of 4. If you want to take only this course, please click the link in the description below this video to access directly the Volume 4 Explain Eye treatments. Before we start, I would like to advise once again that even though I am a physician with trainings and practice in multiple countries in Europe and United States of America, all my online courses and other published materials, including the Volume 4 Explain Eye treatments, are designed for education only. They do not offer medical advice for anybody. They were not created for other teaching faculty or other healthcare providers. They do not pretend to be complete. And very importantly, I have no financial interest in promoting any treatment and any product of any medical company or tech industry. My single priority is teaching and education of the patients about real science, about all of these treatments in ophthalmology. For more information about these disclosures and purpose of my teaching activity, please read the chapter Disclosures and Agreement, Privacy Policy on the website iStory with Narcisa, just clicking the link on the slides. What do I teach about in this Volume 4 Explain Eye treatments of the collection of online courses for patients' education Explain Me Simply? I teach science and correct instructions that we, the eye doctors, are taught when we learn how to take care of patients. They are accepted in all countries in the world because they are taken from practice of generations and generations of eye doctors. In these courses, I do not enter in details that are not accepted fully by all eye doctors. I just explain basic and universally accepted information about eye drops and ointments, injections in the eye clinics, laser treatments in ophthalmology, operations in the eyes, vision improvements with glasses, contact lenses, loupes, and other low vision aids. By knowing this information, you will be able to follow better the instructions of your own eye doctors and opticians and optometrists, and will save your vision. Drops and ointments are administered in the eyes. They lubricate the surface of the eyes, are resorbed and treat conditions of the anterior segment of the eye. Then they are evacuated in a few seconds through the tear ducts in the nose. Learn more about eye drops and ointments by taking the course. You can access the course very simply by just clicking the link in the description below this video. There are many types of injections nowadays used in the eye clinics. Intravitreal injections, injections around the eyeball, injections in the vein of the arm for diagnosis and treatment of ocular conditions. They are presented in the volume 4 just in great details, in simple words for everyone to understand. If you want the information in more details, you can take the volume 3 Explain Eye injections of the same collection, Explain Me Simply, by just clicking the link on the website. Lasers are used nowadays in ophthalmology for many purposes. Improve vision and avoid glasses, glaucoma treatment, treatment of retinal conditions, to fix the retina in retinal detachment treatment or prevention, etc. Learn basic things about the most popular categories of lasers used nowadays in ophthalmology and get empowered so that you will know what to decide for yourself. Take the course Explain Eye Treatments by clicking the link in the description below this video. There is a lot of hope nowadays in ophthalmology in the management to restore the vision in patients with many ocular conditions, from cataract, glaucoma surgery to retinal surgery and complex pole-to-pole surgery after severe ocular trauma. You can learn basic important things about all of these surgical treatments in this volume 4, Explain Eye Treatments. If you want to learn more detailed information, you can access also the volume 5, Explain Eye Surgeries. Just click the link from the slide or copy this link from the slide and then paste on the internet. The best lens to improve your vision is not found in the supermarket. You find it after a correct diagnosis of your eye doctor and with the art and skills of your optician and optometrist. They will advise you if you need glasses, contact lenses, loupes or magnifiers or other low vision aids. They are all lenses developed nowadays to help you to get the best vision. Learn correct things that can help you to see the best for your particular situation of your eyes by taking the volume 4 Explain Eye Treatments of the collection of online courses for patients education, Explain Me Simply. Just click the link in the description below this video. All the courses are available in PDF and also video formats on my website so that they will serve all people, including patients with visual disability and hearing impairment. I invite you to take the mini course Volume 4 Explain Eye Treatments. You will learn what you must know about basic things important for every patient going in the eye clinics for eye treatments. If you like this video, please give a thumb up and please subscribe to my YouTube channel to know when I publish more videos like this, about new materials for education and research. If you want to learn more about the other volumes of the collection Explain Me Simply, see the short videos about each of them in the playlist. See you on my website for taking the course or on my next video. God bless.